transportation. The WHO just this week is convening a review committee to evaluate the international health regulations and how they performed during the COVID-19 crisis, as well as discuss potential amendments. And also just this week, 2 days ago, a group of public health experts that I was honored to join addressed the Unite Summit about a new global convention on public health security in the 21st century. We are calling for, among other changes, to make the international health regulations enforceable and to broaden engagement beyond national governments to include city and municipal governments. Sadly, with increasing globalization over the past several decades, we have unfortunately not seen increased global strength on addressing public health crises. To the contrary, the COVID-19 pandemic seems to indicate that we have only globalized our vulnerability to endemic infectious diseases to an extreme degree. COVID-19 has also revealed fragility in HIV and other health responses, for example, with respect to TB and HCV. The infrastructure developed in response to more mature pandemics, such as HIV, was leveraged to respond to COVID-19, as was the HIV workforce. An IAPAC survey taken from April to June of this year found that 53% of clinician respondents from 75 countries were treating patients with COVID-19. These surveys respondents also reported disruptions in HIV services during the pandemic, with 46% reporting disruptions in monitoring of viral load, for example, and 45% reporting disruptions in trauma-informed mental health care. While there's been many innovation implemented to address these challenges, for example, the use of telemedicine and multi-month ART dispensing, these innovations are not altogether attenuating levels of concern shared among HIV response experts, including at UNAIDS and WHO. For example, in South Africa, 93% of respondents were moderately to very concerned about ART adherence, while 92% of provider respondents in the UK were equally concerned about mental health access. So while it's impossible to quantify the degree to which leveraging this infrastructure has reduced COVID-19 morbidity and mortality, what is clear is that this leveraging has had an impact on our short, mid, and potentially long-term ability to achieve and surpass HIV programmatic targets. This means we need to see sustained investment in local, national, and international HIV, TB, and other health responses, despite divided attention and strained budgets, to get back on the fast track towards SDG 3.3. But we also need to see long-term efforts to address the underlying fragility that the COVID-19 pandemic has revealed in the HIV response, and to ensure continuity of HIV and other health services in the months and years to come. During the COVID-19 pandemic, we have witnessed examples of city multilateralism all over the world, including in 2 cities and municipalities that I hold up as examples. In Atlanta, Mayor Keisha Lance-Bottoms has from the start of the COVID-19 pandemic coordinated with the state government, but also with the federal CDC. The mayor followed guidelines set by the CDC as well as WHO in closing schools and businesses, as well as requiring face masks in certain public spaces. And she has persisted despite confusing and highly politicized guidance coming out of the US federal government, but also serious pushback from her state's governor. While the mayor was listening to public health experts, the governor was tweeting that Atlanta residents could ignore the mayor's lockdown order. He sued to stop measures, including a local face mask mandate, saying that Mayor Bottoms could not implement public health measures that were any more restrictive than his own. Similarly, Sao Paulo began to see cases early on in the COVID-19 pandemic, particularly in the favelas. City and state leaders took action, working with the medical community to prepare hospitals for the coming wave of COVID-19 cases. Municipal health authorities canceled elective surgeries, expanded ICUs, and acquired PPE supplies, even as prices skyrocketed with no federal support. Sao Paulo Mayor Bruno Covas and the mayors of other large municipalities, such as Rio de Janeiro, were mocked by Brazil's president, who encouraged residents of these municipalities to defy local lockdown and face mask orders. While state governors did a lot more than Brazil's president, much was still left to the mayors to combat their local COVID-19 epidemics, and much of the responsibility was left to mayors to decide when and how to begin reopening their municipalities. As I already noted, city multilateralism does not mean replacing the traditional health diplomacy in which nation states are central actors. Rather, we are calling for the vast decentralization that has already occurred organically because city multilateralism is already happening. Two examples include the reliance on cities and municipalities that has occurred during the COVID-19 pandemic and the work that fast-track cities are advancing to end the global HIV epidemic by ending urban HIV epidemics. Additionally, though, we must recognize that creating sustainable cities and municipalities, or SDG 11, is interwoven with virtually every other SDG, including SDG 3. Given this interconnectivity, we cannot expect to make progress across the SDGs without seeing significant support for cities and municipalities from national and international bodies. And we cannot expect cities and municipalities to act in isolation. What role can national governments play in supporting decentralization? Specifically with regard to COVID-19 and HIV, there are several needs. The first is that national governments stop serving as obstacles to progress at city and municipal levels, as we have seen in the examples already discussed from the United States and Brazil. This has also been true with respect to HIV. For example, we can contrast the experiences of fast-track cities such as Bangkok, Kyiv, and Nairobi County, all of which have received support from their national governments, with other cities and municipalities that have encountered resistance. Beyond getting out of the way, there are other steps that national governments can take in supporting cities and municipalities within the context of the COVID-19 pandemic to ensure that HIV and other health services are not compromised. We need cities and municipalities to implement emergency and long-term public health measures. COVID-19 has revealed a lack of pandemic preparedness at all levels, but also fragility in HIV and health responses, notably among key populations vis-a-vis inequities. Cities, municipalities, and national governments must work together to innovate around strategies to minimize in-person contact for health services so that the continuum of HIV prevention and care is not interrupted. Finally, addressing social determinants of health is a critical way in which cities and municipalities are meeting the immediate needs of people who are living with HIV or who have been impacted by COVID-19. Take, for example, housing. Adequate, stable housing is central to all of us, but notably to people living with HIV, TB, and other chronic diseases. We now also see it as essential to curbing the spread of COVID-19. And yet, the COVID-19 pandemic has made it harder to maintain stable housing. In my opinion, cities and municipalities are the best possible actors to ensure that local populations have access to safe and affordable housing. Leaders at city and municipal levels must be thinking about how to secure stable housing for people living with HIV throughout and beyond the current crisis. Thinking past the current COVID-19 pandemic, we also need partnerships for long-term pandemic preparedness. How much risk communication, for example, has been delegated or simply taken up by cities and municipalities during the COVID-19 pandemic? What about with respect to response, preparedness, and human resources? If challenges with international health regulations include interpretation, implementation, and enforceability, then improving the viability of the international health regulations will require national urban partnerships for successful management of public health emergencies. In conclusion, today, in the midst of our current public health crisis with COVID-19, we see clearly the necessity for cities and municipalities to be on the forefront of advancing public health and basic human rights. It is no longer acceptable to relegate urban leaders to the sidelines as a mere afterthought in health diplomacy, and then expect them to play a central role in preventing and containing epidemics or pandemics. This has been true for decades with epidemics such as HIV and TB. Today, it has come into even sharper focus with COVID-19. We need city multilateralism so that the fast-growing urban zones, poised to become more populous in the decades to come, can serve as engines for change and innovation to end the HIV, TB, and viral hepatitis epidemics, as well as tackle future emerging diseases sure to come. We also require that national leaders fulfill their critical role in seeing city multilateralism as an opportunity rather than competition to be hindered. Colleagues and friends, today more than ever, I am convinced that fast-track cities are leaders in the city multilateralism movement. You are key to getting us through the COVID-19 pandemic, ending the HIV, TB, and viral hepatitis epidemics, and confronting future public health challenges. Thank you very much for joining us, and I hope that you have a productive conference over the next 2 days and take advantage of the pre-recorded sessions that were made available to you starting yesterday. We are grateful for the opportunity to convene with you, even virtually. And with that, I am very proud to close my opening remarks and open this conference and introduce a good friend and colleague who I've grown to know over the last year and a half, actually 2 years. He participated in a high-level panel at our inaugural Fast Track Cities 2019 conference in London. And we struck up a conversation that led to an agreement to host the next Fast Track Cities conference in his great city of Lisbon. Regrettably, we were unable to be there in person, of course, because of COVID-19. But as I mentioned earlier in my opening remarks, I'm hopeful that we will be able to come together once again in person in Lisbon to share the experiences and best practices across the Fast Track Cities network as we aim to end the epidemics of HIV, TB, and viral hepatitis in Fast Track Cities around the world. It is my distinct pleasure at this time to introduce Mayor Fernando Medina, the 77th Mayor of Lisbon, who assumed office in 2015. He has a degree in economics from the Faculty of Economics of the University of Porto. He has also a master's degree in economic sociology from the Instituto Superior de Economía e Gestão. I will say that he is one of the urban leaders who believes in close collaboration at the global table to enhance cities' voices in international forums. He stands for a world where respect, care, openness, human dignity, and tolerance are key values of our society. And as such, he is perfect to moderate the first hour of our high-level panel with two esteemed mayors from COVID-19 hotspots. Mayor Medina. You'll be having a technical challenge. So while we wait for Mayor Medina to join us, just a few words about the various sessions that we are hosting throughout the conference. So during the live program, we are addressing cross-cutting issues related to continuity of HIV care, TB care, hepatitis care in the context of COVID-19. We're honored to have, in addition to the high-level panel, a keynote address by Dr. Fauci a little later this morning. And so we are really excited about the caliber of faculty we been able to secure for the conference. In addition, I noted that we have the pre-recorded sessions that are really practical issues. Many of you will find interesting as you deal with COVID-19 in your respective cities, issues ranging from how to reorient health services in the context of COVID-19, telemedicine, mental health, real practical issues that I think you will find of great interest. So I'm hopeful that we will have Mayor Medina shortly. Please bear with us. Ladies and gentlemen, I did advise Mayor Medina will be joining us very shortly, so please bear with us.
Right. Yep.
Mayor Medina, welcome to the virtual Fast Track Cities 2020 conference. As I noted at the beginning of my opening remarks, I wish we were with you in Lisbon, and we're hoping to be with you in Lisbon next year in March. Thank you very much for agreeing to moderate the first hour of this high-level panel with two very esteemed mayor colleagues of yours from Atlanta and from at the Queenie Metropolitan Municipality. I turn it over to you.
Hello. Thank you very much. It's a great privilege to be here in this panel. I want to give a warm welcome to all, and mainly to José Zuniga. It's a pleasure to see you again. I hope that we can find together in Lisbon on face-to-face meeting in next March. I hope that everyone can come. We are eager to receive you here and to have our meeting. It will be a sign that we are in a new phase of this pandemic and that life can return to a more normal situation. I want to salute everyone that is attending this meeting, and mainly I would like to give a warm welcome to my colleagues, dear colleagues, Mayor Keisha Bottoms from Atlanta and Mayor Kaunda from Int'l Metropolitan Municipality. Thank you very much for being with us. It would be very important to hear about your contributions about our debate. As mayors, I know that you are very pragmatic politicians, so I just pass the ball directly to you. And I would like to begin with one question. I will put 3 questions to you, but I would like for you to address them. Basically, the first question is about how are you dealing with the pandemics in your cities, mainly focusing on 2 issues. One, the relationship with regional and national authorities, although we have some information about the situation in the United States, it would be very useful for us to have more detail about what's happening. And second, about the importance of the cooperation between municipalities, because it has been, in our case, the strength and the support from the cities, the several networks that cities are in, have been a major role in overcoming difficulties and problems that are urging at regional and national level. So once again, thank you very much. And Mayor Les Bottoms, I'll just give you the floor. Thank you very much for being here.
Well, thank you for having me, and good morning, good afternoon, and good evening, depending on where you are. I bring you greetings from Atlanta, Georgia, the cradle of the civil rights movement in America, and still really at the forefront of so many issues related to human and civil rights. And what we've seen in 2020 in Atlanta is that COVID-19 really has highlighted many of the discrepancies that still exist in one of the world's greatest cities in Atlanta. What it has highlighted for us is what it's highlighted across America, and I would assume across the world, how communities of color are hit much harder when the unexpected happens. We are seeing the health discrepancies, the underlying health discrepancies that are making communities of color much more susceptible to COVID-19 and the often deadly effects of COVID-19. In addition to that, there is the economic impact. Back in March, the city of Atlanta took the extraordinary step of closing down, as many cities did across the world. What we saw from an organizational standpoint from the city of Atlanta is that many of our frontline workers were many of the people who have underlying health conditions and many of the challenges that make COVID-19 much more deadly. That includes our sanitation workers, making sure that our trash is picked up, our public safety workers, also our watershed workers, making sure that people still have access to clean and safe drinking water. We were able, because of some economic decisions that had been made in previous years, we were able to at least have the financial footing of the city to allow us to issue hazard pay to many of these workers in the amount of $500 a month. That was significant because just as our healthcare workers have been putting their lives on the line, so have our workers who are part of the city of Atlanta. Thankfully, the federal government has now come in with the CARES Act funding, and it has allowed us more room that we don't have to tap into our city's finances in the way that we did at the beginning of the pandemic. But again, just highlighting if you aren't prepared for the unexpected, how devastating it could be to your cities and to your workforce. We also put into place a series of policies that would help small businesses, that would provide food assistance. We took one of our departments that normally provides services, parks and recreation services, and we were able to transfer those workers into an area that they were able to deliver food to many of the children who only received their meals during the school day. We also created a Strength and Beauty Fund to help barbers and hairstylists so that they could have access to funding, small business grants, and the list goes on. We thankfully were very creative in Atlanta, and we have been very fortunate to be able to quickly implement policies that have helped soften the blow of COVID-19. But that being said, without a lack of coordination of municipalities and without a lack of leadership, quite frankly, at the state level and federal level, COVID-19 continues to be a challenge. And so much of that has to do with the lack of coordination across the board, across our states and in our country.
Thank you. Thank you, Mayor Bottoms. It has been devastating to see through the television your fight at state level and even federal level about fight against COVID-19. So all the best and all the support from Lisbon and from our cities. We hope that soon everyone can see a better off situation. But basically, we know that you are basically now on two fights at the same time, against the virus and against the lack of support from other levels of government, and that's devastating and very difficult. So thank you for your words, and the best words from us to Lisbon to you. I would like to have the contribution of Mayor Kaunda about the same dimension. What has been the last months dealing with pandemics? What's the situation? And basically, how has been the coordination and the relationship with regional and national authorities? How things are working, and what's the road that you are prospecting? Major Kaunda.
Thank you very much, Medina and the team. Our appreciation for being invited to come and share our experiences as the city during this COVID-19, as we are also not immune from this pandemic. Etegwini municipality is the only metropolitan city with a population of 3.9 million citizens in the province of KwaZulu-Natal, with another 10 districts which are rural in nature and some semi-urban. The city is also the epicenter of COVID-19 within our municipality, as well as in the province of KwaZulu-Natal. We have incidence rate of 67 per 100,000 population. COVID-19 picture in eThekwini, we had total cases of about 53,498. The total recoveries are 51,380, which then give us that we are now seated at the recovery rate of 95.9%. This is indeed a good story to tell. The total recoveries, as we have spoken about, they do not leave us with complacency. So we still need to focus on our lockdown regulations so that we are able to improve further, since the pandemic has not left the country. Deaths, they amount to 1,046, where we are seated at the death rate of 2% as a city. The city went into lockdown where all movements and all businesses except essential services were closed as from the 27th of March this year. And currently the city is on the level 2 lockdown. As As also as an economic hub of this province, our city is really severely affected economically, with almost all sectors of the economy, especially manufacturing, as well as tourism. When it comes to the support from the national and provincial government, we have a model that we have developed in the country, which is called the District Development Model, where the cabinet, the president, and the command team had decided that they will deploy 2 deputy ministers to be assigned with responsibilities to assist our city during this struggle to fight against COVID-19. We have also our own provincial champion, which is the member of Executive Council, who's assigned to work with Etegwini municipality, so that whatever that is happening at a national level, provincial level, there is an alignment on our strides to fight against this pandemic. The crisis leadership during the pandemic, we must indicate that the city had to adapt to the prescripts of the National Disaster Act as announced by our President, His Excellency, President Ramaphosa. The establishment of our COVID-19 Command Council, which is chaired by the mayor, myself, which also integrate other representatives from the national and provincial departments. So it's worked better for us that whatever decision at this local level we take, at least it is able to find expression even in other spheres of government so that we can align the plans. On the establishment of multidisciplinary special health COVID-19 command response center for dealing with positives, contacts, and daily tracking of COVID-19 pandemic, we have identified hotspots, and we have also provided analysis of this pandemic in those areas and what constitute our strategies and tactics to deal with such. The implementation of the prescripts of lockdown through continuous communication with all our departments and units in the municipality and the citizens of our city through public engagements, through taxi, public transport facilities, and other facilities where people are meeting in numbers. But of course, from the distance, using loud hailers and other forms of communication. But community radio stations, our broadcast facilities have also been utilized so that we are able to communicate, postering, and many other aspects in the area. The issue on the establishment of COVID-19 special areas in hospitals for effective quarantine and isolation and management of COVID-19 cases. Indeed, we're one of the municipalities which also had many facilities, including bread and breakfast and other facilities which were converted to become the field hospital, so that whenever there is a high demand, especially on our beds in our hospitals, we are able to be responsive to such a demand. We have also established our health COVID-19 special response team for active tracing, for screening. We have provided resources from the municipality so that we are able to trace all people and contacts and reach out to communities at all the time. We have also established about 12 temporal shelters for us to be able as a city to accommodate those who are homeless, because we looked at their plight. They were living on the streets, so we had to act and also accommodate them in those shelters. But there were programs which we also intensified in those shelters, including the drug rehabilitation program, which was one of the successful programs in the country. We have been able at least to assist more than 260 people from the homeless. So these are kind of interventions. There are a number of interventions the city have made. Part of that is on social relief. We've been able to support communities through food parcels, through food hampers. We've been able to areas which are remote, where they had no access to water, to ascertain that there is access to water. We've supplied soap, we've supplied sanitizers. We have also disinfected our informal settlements in the areas where we are working. The cleanliness of our facilities was key, because our strategy that we driven to fight this pandemic was to ensure the high levels of hygiene and cleanliness. So therefore, we've been able to do such. So with that, we as a city, we've also been able to look at how do we balance during this COVID-19 challenge, as well as the programs that we've been running as the AIDS Council of eThekwini with our partners on HIV and other health responses. So that has been, the momentum has been maintained so that we do not lose sight of such activities, which are very key in saving people's lives. The city was indeed disturbed by this pandemic by putting services back on track. Data cleaning exercise is also underway to update HIV data, identify and address gaps in relation to 90-90-90 targets. Now at level 2 lockdown, we have also resumed with full-scale services that we have commenced executing in the area, including outreach services for HIV, TB, and non-communicable diseases, screening, testing, and initiation. The city is also focusing on accelerating services to reach 90 targets and to cover the lost time during the peak of COVID-19. When it comes to multilateralism and the city preparedness to respond to this pandemic, we have, of course, partnered with many strategic stakeholders globally, including C40, that is also part, and the fast-track cities, which are part and parcel of our plans, so which has really made impact to save lives during this difficult period. We are also strengthening partnership with sister cities across the globe so that we can share, and in the continent, we can share our experiences so that we learn from one another, because we believe that we can't do things on our own. Even cities around the country, we have platforms where we share our experiences and also put ideas in place to fight against this pandemic. On the hope that for the city and the country, as we approach the end of this pandemic, firstly, we work from the solid foundation that our recovery rates seem to be improving at national. We are seated at 90% as we speak, so which gives more stability, as well as retaining back to normal operations of government, because we as municipalities have also suffered when it comes to revenue collection, because we were unable. In April alone, we have lost revenue because we only collected about 56%. It's only now then in May, June, where we are starting to improve as we bring back all the workers 100% to be fully fledged operational. The city has also developed a comprehensive economic recovery plan to cushion businesses from the impact of COVID-19 and save jobs and livelihoods. Today, we have launched our Economic Council of eThekwini, which brings together all social partners, including government, business, organized labor, civil society, and academia, to provide guidance on how to unlock the city's economy post-COVID-19, as well as to work from the good foundation of our economy, where we attracted more investors, and we are busy interacting with those investors so that they can still sustain their investment in the city. As a vote of confidence in our economic recovery plan, large multinational companies have committed to retain their investment in the city. These companies will be reabsorbing workers from the jobs that have been lost. But part of our way forward as a city, we agreed that we need to treat COVID-19 as the opportune time where we can bring new ideas under this new normal, leverage from the opportunities and the potential of the economy that we have, so that we can continue and save people's lives whilst we are maintaining the economic activities in the other vein. So with that, we wish the conference everything of the best. This is how we've been able as a city to work with our national and provincial government to ascertain and to see to it that people's lives are saved, but whilst on the other side, we advance the economic activities and to ensure that our economy becomes more inclusive. We elevate the role of cooperative and social enterprises so that social solidarity economy can find expression in the city. Thank you very much.
Sorry, everyone. We seem to have lost Mayor Medina, so I am going to take the chair until we can try and get him back on. I'd like to ask a question of Mayor Bottoms, and particularly whether, as mayor of Atlanta, you ever expected to engage in city multilateralism to prepare your city to respond to a global pandemic such as COVID-19?
What I will say is that there are many things that we prepare for and have prepared for as a city, but preparation for a pandemic was not at the top of that list. Fortunately, we recently appointed a chief health officer whose primary focus was to be on our HIV and AIDS rates in the city of Atlanta and lowering those rates. Thankfully, because she was in place, we could very quickly navigate to our pandemic response. On the front end of responding to COVID-19, we really were anticipating leadership, consistent leadership from the state and certainly from the federal level. But my charge to our senior team at the city was very simple. God bless the child who's got its own. And my charge was that because I knew that even with the best of leadership and coordination, that the city of Atlanta perhaps could get lost in all that would come with anyone trying to manage a pandemic. So that is the reason we were very aggressive and on the forefront in taking steps to make sure that the people of Atlanta would be as safe and as protected as they could be. But that being said, it was not my anticipation in 2020 that we would be faced with dealing with the management and leadership of a pandemic. But what we've seen in our actions in Atlanta, they really have been a guiding post for cities across the state because of the concerns that we've had from the leadership of our governor.
I really commend you, Mayor. The work that you're doing in Atlanta is really a model for how many other US and cities around the world should be tackling infodemics and, a lack of relying on an evidence base, on science to guide our public health decision-making. I'd like to ask the same question of Mayor Kaunda. So did you anticipate, Mayor, when you started this year, that you would be charged with really creating an infrastructure for addressing COVID-19 in Etequini?
Thank you, José. The city, we were all not looking at the uncharted journey of this pandemic, but the sooner the identification of the first case, our government was quick to respond so that we put systems in place. In relation to infrastructure, we had to spend budgets which were not allocated for, but we had to make some budget adjustments so that we become responsive to this pandemic. Otherwise, there was no way to be putting aside our own actions to respond to this pandemic on the basis that it was not budgeted for. But national government also allowed us to make some adjustments on the other national conditional grants to be converted for the purposes of fighting against this pandemic. So we think that's a strength in which we were able to maintain the numbers as we are seated, but we are able also to spread messages for our own people to take precautionary measures to ascertain to save people's lives.
Okay, thank you, Mayor Kaunda. We are again from Lisbon. I would like to go again to Mayor Bottoms and to ask her to go a little further about the answers in Atlanta, namely in this context of the federal lack of coordination and even at state level. And I want you, in your answer, please, if you can address one very important issue that is at stake in every city, that is the question of the answer to other health needs that are not COVID. There is a strong debate in everywhere that the resources that cities are applying to COVID, what is being left to deal with other diseases, and if we are doing enough, or if we are not creating a situation from other diseases that are not getting the right answer from the health systems. And if you can go a little more on that, what's happening in Atlanta, how you are dealing with that, what's the debate on that, how the, what's your perspective? And if you can focus namely on the HIV the patients that are dealing, that have to deal with treatments during this pandemic. What is happening here in Atlanta? What's your vision?
Well, that's a very good question, and a very personal question, and I'll tell you why. My husband, one of my children, and I all were diagnosed with COVID. And the other part of that was the lack of coordination with testing and being able to quickly get our results back, which continues to be a challenge. We had a child in our house who was positive, asymptomatic, and we didn't know it. And 1 week later, when we were retested, my husband and I were both positive. I share that story because as of this morning, not even an hour ago, my husband was at the doctor's office with some follow-up visits relating to some lingering side effects of COVID. And what we are seeing in Atlanta, and really a challenge across the country, and this is a conversation my husband and I had, we are assuming that all of these side effects are COVID related and that you just have to tough it out. But it dawned on my husband and I that perhaps they aren't COVID related. Perhaps there's something else going on not related to COVID. We can't make that assumption, and he should go and follow up. I share that again because I was having, and this is an anecdotal information that I'm sharing with you, but I was speaking with a pastor of a very large church in Atlanta, and he shared with me that he's been doing more funerals than normal, that he normally does 3 funerals a month. He's now doing 3 funerals a week. And I said, why? Is it because people are dying of COVID? And he said, no, it's people dying of other things, but nobody's going to the doctor anymore because of COVID. And so what we know is that this is going to continue to be a challenge as we enter the flu season. People are not going to the doctor. I just realized yesterday, even one of my children should have had a yearly physical in June, but because of COVID, I didn't schedule his physical as I normally do. So we've got concerns about vaccinations, children not getting their vaccinations on time, people not going to get flu shots because they are afraid to go out and be exposed to COVID. And then certainly from a city perspective, as I mentioned, our chief health officer was to focus on HIV and AIDS rates in the city of Atlanta. But over the past few months, since March, well, actually since February, her sole focus has been on COVID-19. So this is certainly a concern that we have, that very important health issues, lingering and chronic health issues that we find in our communities in Atlanta are being ignored because our attention, our focus, and our resources are all based on COVID right now. But what we know is that high blood pressure, diabetes, our HIV AIDS rates, cancer, all of these things still exist, but we just aren't focusing on them and putting our resources and energy towards addressing them right now.
And do you feel that there is an evolution on that situation, or not yet, that the system is all focused on COVID?
I think it has to be an intentional evolution. And what I've shared with my team is that we are now in what someone described to me, not the new normal, this is our now normal. And so we have to begin to put in place and make sure that we are operating in this now normal for the foreseeable future so that we can get back to proactively addressing many of the issues that are concerns to our communities that have been put on the back burner because of COVID. but I can tell you it has to be an intentional effort, an intentional focus to unfocus on COVID, because certainly it hangs over and is lingering over all of our lives and our communities.
And can you tell us a little bit more what's happened with common people, with regular people, because how people are dealing in Atlanta with these mixed messages about the federal government disregarding all the approaches of social distancing, of wearing masks, of safe behaviors. How are people dealing in the daily life in Atlanta? People are aware, people take care, or people simply are confused and the situation is worsening because of that?
I think the mixed messaging has been very confusing to a number of people. There are people who are listening to the federal government and listening to leadership that's not taking COVID as seriously. And then there are others who are listening to the science. I've been encouraged as of late, as I've been out and about in Atlanta, that people are wearing masks in our city, but I think what it's happening, it's taking for people to get sick in families and communities, for people to realize that this is not just someone else's problem. And so the mixed messaging certainly doesn't help. But that being said, we have pushed out enough messaging, I believe, that it's able to counter the messaging that's not based on science. And very fortunately, I have to give credit to Dr. Carlos Del Rio from Emory University, one of the leading infectious disease experts in the country. He has been consistent in his guidance and recommendations to the city of Atlanta. But we also, on the front end of COVID-19, put in some very objective criteria in place in the city so that it wouldn't get lost in the personalities, that it would be based on data and science. And that was, how would we recommend that people reopen the city? How would we recommend that people reopen their businesses? And it's really been a mixed bag, because our governor has said that our state is open for business as usual. There have been some people who have gone with that recommendation, but there have been others who said what you're doing in the city of Atlanta is based on science and data and recommendations from healthcare professionals, and we're going to follow those guidelines. But again, it's also our responsibility to make it easier for people to follow those guidelines. So for small businesses that don't wish to reopen, we have to make it easier for them to access funding and support mechanisms so that their businesses can survive. Because the statistics right now are that 40% of Black-owned businesses in America will not survive COVID-19.
Let me ask you another question, is about the flu, because we are entering in a period of time where we have schools opening, where we have the flu season that is appearing. How are the things happening in Atlanta? People are preparing for the flu season. The anti-vaccine movement has any strong that is shaping public opinion. How is everything being approached with this difficult time, difficult, challenging months that are going ahead?
Well, I received my flu shot yesterday, and I am going to make sure that I let the public know that I've gotten my flu shot. And I actually thought it was a bit early to get it, but September clearly is not too early to get the flu shot. And that's going to be so important, because we have so many people who don't get vaccinated for the flu, and who die of the flu, something that certainly, I've had the flu with a vaccine, but certainly the effects were a lot less severe than they would be. So we're going to continue that with our messaging and make sure that we have places in the city of Atlanta that people can go and get their flu vaccine. But again, it has to be intentional, and even more intentional this year in encouraging people to get the flu vaccine. And then on top of that, we have the challenge of our kids returning to school this year. Many are in hybrid learning situations where some are back in school full time, some are a combination of virtual and in school, and some are virtual only. And I know that my kids' school, for example, offers flu vaccines normally during the school year at the school. But this year, my kids, for the time being, are virtual only. So I have to be intentional in making sure that they get their flu vaccination from their pediatrician. So again, I think it is going to be incumbent upon all of us as leaders to think past the next step and anticipate these challenges that will face our communities so that the flu season is not upon us when we are encouraging people to get a flu vaccine, but we are already encouraging people along the way.
The decision about the schools going virtual or mixed system is a city decision, is a state decision, is school decision?
So again, inconsistent leadership in our state. The governor has deferred to each local school district to make decisions about when and if they will return to school. We've already seen the stories of crowded hallways, kids not wearing masks. And again, they're children. I have 4, and I've watched my children fidget with their masks, taking them on and off. So it is challenging for our children to consistently adhere to all of the protocols that are in place. But every school district can make its decision on how and when it returns to in-classroom learning. And again, the challenge with that, we know that children are dying and are impacted with COVID-19, but the larger challenge is, as happened in my household, that younger people are often asymptomatic and they come home and they infect others. And we have to be concerned about our teachers, our school bus drivers, the people who clean up the classrooms, the people who work in the cafeterias. Those are the people that we have to be concerned about. But unfortunately, there are multiple districts, school districts in the state of Georgia, and they all get to choose how they respond to COVID-19 in terms of learning.
Thank you, Mayor Bottoms. We are going to return to you before we end this panel, but I want to return now to Mayor Kaunda and basically to ask him the same issue. It is about the relationship with the health system and what's happening with the approach and the importance that the health system is giving to other diseases that behind COVID. Is the situation that the system is now getting attention to other types of situations, and I'm going directly to HIV patients, or we are not in that phase yet, and we have the problems of all the energy concentrated in COVID and other diseases getting behind, other conditions getting behind.
Thank you very much for the question. We have a unitary state in South Africa. So decisions are taken at a national level, and they have to find expression at the sphere of province and the local government level. So this also enables us as municipalities through our representative bodies like South African Local Government Association, whenever there are issues that we wish to raise through Parliament and in the provincial legislatures, they do represent us in that respect. Then coming back to the issue on how we've been challenged in terms of the primary healthcare as well as the economy, we must accept that this pandemic has exposed us on the economic fault lines, where we still need to do a lot, especially to empower the poor communities so that they can partake in the mainstream economy. So that is part of what should be elevated during this new normal, so that our communities also do participate in the economy. The second issue on the facilities, health facilities, of course, we were able to have some time when we decided at an earlier stage that we must shut down so that we allow the health system to be prepared so that when the numbers are increasing, we'll be able to cope. As a result, even some of the field hospitals have not been utilized because our systems were already improved to be more responsive to the crisis of this pandemic. On HIV and AIDS, we are one municipality that has also adopted an a service delivery model, which we call Operation Sumasake, Let's Rise and Build. So that operation ensures that each and every ward of our municipality has got what we call a war room. In that war room, we have localized strategies to deal with HIV and AIDS, gender-based violence, crime, and other issues that are related to socio-economic issues of our society. So that has enabled us, because on monthly basis, we've been going on out to all wards, working with our community caregivers who are recruited to ensure that they do take care of those who are unable to take care of themselves, as well encouraging people to take their medication, bring them on board to those who have been defaulting so that they can be able to follow the right processes of their medication. So with that, we are hopeful through our AIDS Council at a municipal level. There are many decisions we have taken, but the pandemic has disrupted us. But immediately, as you are now moving to the lower levels, we are hoping that those programs and plans will be able to find expression in all communities.
Thank you. Can I ask you about the situation in schools? What is the situation related with the schools, with the kids, virtual lessons, in-class lessons, or no classes at all in any districts? What's happening?
Yes, it became a big question when the National Command Team announced that the schools would be reopened. There were different views, but we eventually rallied behind government to agree that we need to take national measures. There is no school which will be open without proper facilities to fight this pandemic. Hence, there was a procurement of many PPEs and putting sanitation services to the schools where they did not exist, putting water tanks in the schools where they had challenges with the supply of water, to ascertain that the high levels of hygiene is maintained at all levels. So we did open, but other schools had already started to use virtual classes, those schools with capacity, because we also understand that in South Africa, we still have schools without proper infrastructure, so and technology as well. So the government have been intervening to supply material and your tablets and other stuff to assist learners to learn from the distance. But schools are now being reopened, and we see smooth operation. Cases when they were reopened on the first week, yes, the numbers increased, but during the process, we had lower numbers, which then means that system that was put in place is working and is working properly.
Let me ask you another question. Is that one last question is about the cooperation between cities. Did you find during this pandemic that learning about other cities, it was useful for you? It was frequent? You participated in networks where you exchange experiences about health, food supply, about schools, about the situation, about managing a pandemic that I expect that no one was prepared to deal this, namely in the Western world. How was your case? How important it was the cooperation, the dialogue between cities, nationally and international level?
Yes, thank you very much for that question. We've been interacting with other cities through our Department of Cooperative Governance and Traditional Leadership, which is playing a coordinating role of all municipalities within the province. So we've been meeting, sharing ideas with other municipalities also having shared services. If the municipality has got no capacity of water, the other municipality will then come in and assist so that we are able to deliver water services to our people. But part of what we have been really capitalizing on is these virtual meetings, because it was difficult to meet physically. So we've been using virtual meetings to communicate, interact, learning from one another. And with that, we have learned a lot from different municipalities. But what we are happy about is that even the municipalities where we thought the numbers won't increase, but we realize that there is much more to such municipalities to give them necessary support at a provincial level and at a municipal level. So we've been enjoying support from different stakeholders, the interfaith groupings, business coming on board, supplying material, PPE, supporting our municipality, even on issues of water. There are NGOs and NPOs which also donated water tanks to be supplied to communities. So the collaboration, I think during this COVID-19, there is a lot that we have done to work closely with each and every stakeholder to ascertain that we are together in the fight against this pandemic.
Thank you, Mayor Kaunda. I would like to return to Mayor Bottoms. And I want to make a question about the situation that you are facing here at the same time, that is about the racial tensions that we are seeing happening all around in different cities of the United States. How is that dealing with two such big crises at the same time? And for you as a mayor, when you deal with everyday aspects and dimensions like the act of the police forces or the funding of the priorities, how is happening that in Atlanta? How are you dealing with that?
Well, 2020 has been like no other year that I have experienced in my lifetime. And it's often described as these two pandemics that we are facing in America. One is the pandemic of racism, and certainly the other is COVID-19. There are the operational challenges of what we are dealing with as it relates to COVID, with the large gatherings and protests that we've seen in our streets. Again, encouraging people to take precautions, because given that we are in the midst of a pandemic, certainly large congregations of people make exposure that much more likely. But certainly respecting and understanding that there is a need for people to visibly be able to demonstrate and show their frustration with where we are with racism in America. And it really has been a balancing act. We've been very tolerant in the city of Atlanta because as the home of the civil rights movement, we certainly respect and encourage peaceful protest. But also encouraging people, taking another step, encouraging people and setting up testing sites for people who have participated in large mass demonstrations so that they can be tested for COVID-19. But again, being intentional about continuing the work that has to be done in spite of COVID-19. So over the last several months, we've embarked upon a very aggressive reformation of our police department, making sure that our policies are where they should be and that our training is where it should be. That work continues. Also making sure that we are being thoughtful about the mental and physical health of not only the demonstrators, but also our police officers who have been working around the clock, managing the protests and responding to some of the protests that we've seen, but also knowing that they are putting themselves at risk for exposure with COVID-19. So it's been a very difficult balancing act, but again, important that this work continues, because what we know is that we have to have social justice reform, meaningful social justice reform, that we have to reform many of the policies of our police department. That work is extremely important and has to be done whether we are in the midst of a pandemic or not. but it certainly has been a drain on our resources, just in terms of how we balance and manage the two equally important challenges facing our communities.
Yes, and I recall something that you said since in the beginning of this meeting, that it was the question of the COVID just open up the gap, widen the gap of injustice or inequity at different levels. No? So it's a very dazzling puzzle that you are facing. Let me finish, and I'll just ask you for a last remark about what you want to say. Just one question is that about the diplomacy between cities, because here in Europe, what we saw during this pandemic, it was in many times that state level diplomacy didn't work. At a certain time, states were competing against each other for materials, for supplies, for a bunch of things. The diplomacy between cities helped a lot of networks raise importance, people exchange, having Zoom meetings with colleagues from mine from other cities, other capitals, for Paris or London or Copenhagen. It was regular to exchange ideas. A lot of ideas of experience were useful. So a new network of diplomacy raised importance. Did you feel the same in the United States? Do you feel the same inside the United States or between Atlanta and other cities? Do you feel that is happening, that in your case, and if it helping anything?
Certainly, I've had more contact and discussions with mayors, not just in Georgia, but across America over the last several months than I have in my entire tenure as mayor. Part of it has been the response to the social justice activism that's happening in our cities, and how we are responding and being respectful in our response to many of the gatherings that are happening. I communicate with a group of mayors on that. The other part has been our response to COVID-19. Even in the state of Georgia, coordinating with mayors on how we enacted our mask mandate in spite of the orders from our governor, how we would respond to the lawsuit being brought by our governor, and even with the lack of coordination and support from the governor in Georgia. Governor Andrew Cuomo in New York reached out to Atlanta and to the city of Savannah in Georgia and sent us test kits and giving us support to help us get started with contact tracing. And so these are interactions that likely wouldn't happen under normal circumstances. But what it has highlighted is that in times of crisis, leaders will and should come together for the common good. And often that coordination has been from unexpected places, but it's certainly something that I hope, and I'm sure you can agree with this, that will not end with COVID-19, because it's very helpful, because oftentimes as a mayor and as a leader, you feel very isolated, and you often feel as if you are the only one dealing with these challenges. But sometimes it's just helpful to know that other people are dealing with the same challenges. And what I said as it relates to COVID-19, good leaders sometimes follow. They lead, certainly, but oftentimes it's just as important that you follow. So as it relates to even criminal justice reform and social justice reform in Atlanta, what I found is we don't have to reinvent the wheel at every turn, that there are other cities who are doing things better than we are doing, and it gives us an opportunity to follow. And in the same way, Atlanta has given other cities models to replicate that have been beneficial for their cities as well. So the short answer, there's coordination like I've never seen before, and I certainly hope and expect that this won't be the last of it.
Thank you. Thank you, Mayor Bottoms. Thank you, Mayor Kaunda. It was a very good discussion. It was very good to have you with us, sharing all your experiences. And personally to you, Mayor Bottoms, all the best for the next months, all the best for November. Everyone is watching all around the world. You are going to vote. We are not going to vote. not even by mail, but we are going to follow the results very, very attentively. So thank you very much for your participation. And I hope to see you in Lisbon. If you don't know it yet, it's really deserves a visit and a travel. You are most welcome here in March. Thank you very much.
Look forward to seeing you soon.
Thank you.
Thank you very much, Medina, and everything of the best to Mayor on their elections.
Thank you very much.
Thank you, Mayor Medina, and thank you, Mayor Kaunda and Bottoms, for enlightening first hour of our high-level panel. I know, Mayor Medina, you have to leave us now to get back to the business of running your city. But as I noted earlier, I hope to see you again in March of next year,
Yes.
along with as many of our fast-track cities as possible. Thank you again.
Thank you very much.